Hello emergency department physicians. We have completed the pilot implementation of the Canadian Syncope Risk Score at the Ottawa Hospital, and we are switching to the RAMO Sync trial, which is remote cardiac monitoring of at-risk syncope patients after emergency department discharge. The primary objective of this study is to compare the proportion of patients with arrhythmia identified that required treatment between the two study arms, which are 15-day live cardiac monitoring versus usual care. Patients with a Canadian Syncope Risk Score of more than equal to 3 and are being discharged from the emergency department are eligible to be included in the randomized controlled trial. Patients with score less than 3 will be included in an embedded observational study. The secondary objectives of this study are to assess the 30-day outcome for all patients, reevaluate the optimal duration of monitoring, and reconfirm the accuracy of the Canadian Syncope Risk Score. The study procedures are exactly like the implementation study. You can complete the form using the research link within Epic. First, confirm the patient is 18 years or older. Make sure they did suffer true syncope and present it to the emergency department within 24 hours of the episode. True syncope is a transient loss of consciousness followed by spontaneous complete recovery. Make sure that the patient does not have any of the below-mentioned exclusion criteria, which will suggest that the patient either did not have syncope or risk stratification is not needed. Prolonged loss of consciousness. Significant trauma requiring admission. Any mental change from baseline as described. Loss of consciousness which happens with witness seizure, or with alcohol or drug use and GCS less than 15, or is associated with head trauma. And lastly, any serious condition identified in emergency department that requires hospitalization. Let us look at the Canadian Syncope Risk Score itself. There are 8 predictors in 4 categories: clinical evaluation, electrocardiogram, lab results, and presumed emergency department diagnosis. Clinical evaluation. Did your patient have a predisposition to vasovagal symptoms, any history of heart disease, or abnormal systolic blood pressure during the emergency department stay? Electrocardiogram. Does your patient have any of the following electrocardiogram abnormalities? Remember to choose negative or positive for QRS axis and fill in the value. The calculator will automatically determine if the QRS axis is normal or abnormal. Lab values. If a troponin was drawn, was it elevated? A positive troponin value is above the 99th percentile or 14 nanograms per liter at the Ottawa Hospital. If a troponin was not measured, select Not Done. Lastly, what is your diagnosis at the end of the emergency department visit? Vasovagal syncope, cardiac syncope, or other. Please select only one of the 3 options. The risk score calculator will calculate the score automatically for you. If the total score is 3 or more, and the patient is being discharged from the emergency department, please request permission from the patient to be contacted by the research team. Please enter the patient's name at the end of the form. Indicate if you would like an outpatient cardiology follow-up for this patient. Then click Submit. An email will be sent immediately to the study team. From 7 a.m. to 8 p.m. every day, the research team will see the patient in the emergency department. Outside these hours, the research team will contact the patient for next day morning enrollment. For patients with score more than and equal to 3 and not interested in the monitoring study. And for patients with score less than 3, please obtain permission from the patient for research team to contact the patient for 30-day follow-up and use of leftover blood. All details about this embedded observational part of the study will be explained to the patient by the research team during the follow-up telephone call. One major difference between the completed implementation study and the new monitoring study is that monitors are no longer available in the emergency department for distribution by department staff. You will have to call the study team for enrollment and randomization for any eligible patients. Some tips to keep in mind. Only complete the form at the end of the emergency department visit. Please remember to obtain permission from the patient for contact by the research team. For patients with score more than equal to 3, indicate if cardiology follow-up is required. For patients with score less than 3, obtain permission for research team to contact them for 30-day follow-up and manage these patients as per usual care. Please complete the online form at all times 24/7. If you need to contact the research team, send message through the Epic chat message to Team Venk between 7 a.m. to 8 p.m. every day, or call 613-823-1299. For those not enrolled in the monitoring study, Patient infographics provided at the end of the form can be used for discussion. Refer to the study posters in the emergency department for details. Thank you for your contribution towards research.